Let's talk for a few short minutes about what is deep tissue massage. Some of this is going to be similar to the information from the other video, which was deep tissue versus Swedish massage that I made recently, but this is a separate short feature for those of you who just want to understand deep tissue massage in a quick manner and kind of don't care about the Swedish explanation. Quickly though, before I get started, take a moment, firmly press down on that like button and give me a like. This helps me know that you like the content that I'm making for you, and it also tells YouTube that more people should get to know this video. Yes, your like is that powerful. Please use it. I sincerely encourage you. Deep tissue, otherwise known as deep tissue massage therapy, is a slow and deep massage therapy style. In this style, the therapist is going to usually lower their table than in other styles. This allows them to have greater pressure through the use of leverage of that low table. Then they couple that with moving slower to really get deep into the body of the person receiving. The slower nature of deep tissue massage is meant to find and relax muscles that can be found as 4 to 5 layers deep. Not every part of the body has that many layers, but some parts do. This means that the therapist can start working super close to the bony surface, and this is partly why this style is a slower style. Also, it allows the layers to relax and release with the slowness. The body adapts easier. The therapist has to be more precise when working in certain areas because they're near bones, organs, or endangerment zones, and they have to do this for your own safety. The other reason to get deep tissue massage is the only way you access those deep muscles is by relaxing the topmost layers first, which is why you should always book like a 90-minute or longer session. Think of it as being in a railroad style apartment. In order to get to the other side of the apartment, that's on the other side from the entrance door, then you're going to have to walk through all the other rooms before getting to the furthest room, or in the case of the body, the deepest layer. Deep tissue focuses less on relaxation and enjoyment, and what it really focuses on is reducing muscular restrictions and improving the structure in your body. Some people think deep tissue massage has to be painful, but it doesn't. It's just partly why a therapist has to work slower to allow the body to adapt. It's not like we have some secret massage therapist strength training boot camp on an island or something like that. Oh, no, 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 none of that. With regards to pain during deep tissue massage, no matter how careful the therapist is, there's going to be a feeling of intensity when accessing the muscles that haven't been released in months or years in most cases, unless you're getting frequent massage, then maybe it's days or weeks. Over time and without usage, those deeper muscles will develop knots, trigger points, and sometimes even scar tissue. Deep tissue massage will get to the area, but the intensity comes from when those things are finally released. They've been short and tight for a while. Sometimes with deep tissue massage or medical massage, you could be left with a feeling of soreness the next day. That comes from the nature of this work being so precise in handling your specific imbalances that your body can feel a state of mild soreness post-massage. It's because your muscle fibers, your fascia, and your joints have all been reset, aka realigned into a healthier state. Sometimes we have so many knots and imbalances in our body that we begin to live in pain and get used to living in pain. So when a massage therapist comes and fixes you back up, you have to get used to living in a healthier state of being, which I know sounds funny, but when you've been that messed up for that long, it's true. This is only temporary, this feeling, and this is what I call an adaptative soreness. It's similar to gym soreness, but unlike gym soreness, you can move well and your body doesn't feel as heavy. I refer to this type of soreness as a therapeutic soreness as well. It hurts the body a little bit, but your body will be in a better state from receiving deep tissue work. And there's good pain and there's bad pain. There's the good pain. Another fact about deep tissue massage is it tends to use less oil than Swedish massage. This is because in order to get into those deeper layers of muscle, you need less lubrication. Less lubrication means less slipping off of the muscle or the targeted area. Deep tissue is handy when you want to improve your posture, but without some physical therapy and massage therapy, you may not be able to self-correct more advanced imbalances that have become a chronic pain issue. And this fact I consider to be one of the biggest benefits that come from this style of massage therapy. Your posture, it'll alter when muscles at a particular joint become imbalanced and one side of the joint becomes tight while the other side of the joint is usually long and overstretched. In these type of videos, I like to use the shoulders coming forward as an example. It doesn't matter if you move, you don't move, you're semi-inactive, or you're a highly active human. The joints become imbalanced in time, just like when your mom would say, if you're gonna make that face, it's gonna stay that way. It's true with all the joints in your body, including the facial joints. The imbalance is created based on how you hold your body throughout the day. To fix this imbalance, you need, on the tight side, to lengthen those muscles with stretching and massage, and deep tissue can really make a difference in the massage part because it removes all the nuts and the trigger points in the deepest layers of muscle as well as the superficial. And I'll explain a little bit more about what trigger points are. Just make sure you do that by clicking on the subscribe button, and make sure that you hit the bell notification next to it to make sure it gives you all the updates rather than just a few. And that's going to pretty much summarize my explanation on what deep tissue massage therapy is for today. And if you haven't by now already haven't pressed the like button, then what I want you to do is, now that I've proven the value of this video, press down firmly on that like button and to give me your approval. Aside from that, I thank you so much for watching and see you in the next video.